catch you later for step 2. I'm telling you it will. So if you take anything out of this podcast is if you really want it that bad, you work hard, and if not, like we discussed other options in medicine. But yeah, the pass or fail has alleviated the pressure from us, which that was the goal to do. But everyone's like, oh, I don't have to study that much. I just gotta pass the thing. Okay, good. Okay. You get caught later. I've never seen it otherwise. It always happens.
So I want to like talk about this a little bit more in the sense that so for example, most Caribbean schools follow so there are 2 ways to do a curriculum, right? A subject-based or a system-based.
Yep.
And most Caribbean schools tend to follow a subject-based approach, including St. James. But St. James is a little different because we have a hybrid where we do a review in a system format.
Correct.
In your experience, and I would say 80 to 90% of Caribbean medical schools follow a subject-based, or they're following something like us, which is kind of a hybrid mixture of both.
Yeah.
And the reason we do this hybrid is because we feel like once you teach everything on a subject-based, the system kind of brings it all back.
That's it.
But in your mind, is there a particularly more advantageous approach versus between subject and system?
Everyone learns differently. So what I realized is from the majority of students I've worked with and myself when I went through curriculums, especially St. James, subject is the best because when you start in medical school from the first time, because this is clearly you started medical school for a reason, you get really confused when you take a system like cardio and you hit everything within cardio because it's broken down that way versus you go little by little, you learn anatomy first, histology, embryology. You can appreciate the biochemistry of things. You can appreciate microbiology, the bacteria, the viruses, and all the bugs and drugs. And then when you get to systems, we're doing cardio? Yeah, you learn the cardio, but then when you go over micro, you say, but I've been exposed to micro. I've been exposed to the bugs. So now I can appreciate the differential of a cardiological disease.
Okay.
I say, interesting. The person has, or like respiratory, person has pneumonia. But then now I can understand why the pneumonia he has is actually tuberculosis because I did it before, which then I know why it's TB, what drug we provide, what's the mechanism of action, and so on. So I've realized for the majority, system is not for everyone. It's usually subject first and then hit the systems hard to bring it all together.